She had delivered 412 babies. She had assessed thousands of newborns. She thought she knew what normal looked like. Hazel knew what wrong smelled like. Petra Nolan had been a certified nurse midwife for 8 years. She caught babies. She assessed them. She trained new midwives to look for the clinical indicators that preceded problems before the problems announced themselves. She was not someone who missed early signs in infants. She was someone who had written checklists about early signs in infants. Leo was 3 weeks old. He was her first child, and she had watched him with the particular intensity of a professional encountering the thing she had spent a career caring for inside her own home. His weight gain was appropriate. His feeding was frequent and adequate. He cried the normal amount. By every measure she applied, Leo was fine. Hazel was their 4-year-old golden retriever. She had been gentle and patient through the pregnancy, through the birth, through the first 2 weeks of Leo's life. She had accepted the new arrangement of the house, the crib in the corner, the altered routines, with the equanimity of a mature animal. She was not, by any behavioral history, a resource-guarding dog. Then, without warning, she began guarding Leo. Not aggressively, not with teeth or posture. She simply placed herself between Leo's bassinet and every person who approached it. Petra's mother, her husband Ronan, the visiting health visitor, the neighbor who came to see the baby. She would position herself between the visitor and the bassinet and sit there, blocking, until Petra moved her. She moved immediately when Petra moved her. But she returned. Ronan said on day 4, "She's done this every time someone walks toward the bassinet." Petra said, "It's resource guarding. She's claiming him. I'll work on management protocols." Ronan said, "She doesn't do it with you." Petra filed this away as matrilineal bonding behavior. She had read about that. It was a known thing. She managed Hazel for 6 days, moving her, redirecting her, reinforcing alternate behaviors. Hazel complied with all of it and returned each time to the same position between the bassinet and whoever was approaching. If you stay for stories about what animals sense before we do, you are in the right place. Subscribe so you don't miss the next one. On the 7th day, Leo's weight check showed a loss of 6% from birth weight. Not alarming in itself, weight fluctuation in the first month was common. But Petra looked at the number and felt something she would later describe not as clinical concern, but as something quieter, like a discrepancy between what she had measured and something she couldn't measure yet. She thought about Hazel. She thought about 7 days of consistent positioning behavior from an animal who had never resource guarded anything in 4 years. She thought about Ronan saying, "She doesn't do it with you. A dog who guards from others but not from the mother is not guarding the resource. A dog who guards from others but not from the mother is alerting the mother." She called the pediatrician. She described the weight loss. She mentioned that her dog had been behaving oddly near the baby for 7 days. The pediatrician, Dr. Adela Fontaine, scheduled an appointment for the same afternoon. "Has your dog ever done something that made no sense until it was the only thing that made sense? Tell us in the comments. These stories deserve to be heard." Dr. Fontaine's physical examination identified the olive-shaped abdominal mass that is the clinical hallmark of pyloric stenosis, a thickening of the muscle at the stomach outlet that prevents food from passing into the small intestine. In an infant Leo's age, the condition presents insidiously. Feeding appears adequate. Vomiting, if present, can be subtle enough to miss. The weight loss is the visible consequence of an invisible obstruction that has been building since birth. Dr. Fontaine said, "At this presentation, surgical intervention is standard, and outcomes are excellent." She said, "We would typically see this come in when the infant is more symptomatic." "You caught this early?" she asked. "What made you look more closely today?" Petra said, "My dog had been trying to tell me for a week." Dr. Fontaine was quiet for a moment. Then she said, "Dogs have been documented responding to metabolic changes in infants, shifts in scent profile that accompany developing illness. Your dog smelled something we couldn't see yet." She paused. "That's a good dog. Every guardian deserves to be recognized, even the ones who never ask for anything in return. If stories like this matter to you, subscribe so you never miss the next one." Leo's surgery was straightforward. He came home 4 days later with no residual complications. Hazel was at the front door. She walked to his carrier and pressed her nose gently near his face and exhaled once. Then she stepped back and sat down and did not guard him from anyone after that. The obstruction was gone. Whatever she had been reading in his chemistry for 8 days, she could no longer read it. The next story is about a dog who knew a toddler had swallowed something dangerous before anyone in the house noticed anything was missing.